Hello everyone, and thank you for joining today's webinar, Seize the Day for Babies, CCDBG, and its opportunities for infants, toddlers, and the providers who love them. This is the second webinar on this topic, and today we'll be focusing in on payment issues for providers who are specifically serving babies and toddlers. I'm Yvette Sanchez-Fuentes. I am with the Community Action Partnership of San Luis Obispo County, and I'm happy to be with you all today and facilitating today's session. A quick note, due to the large number of participants on today's webinar, we are operating in a broadcast-only mode. However, we really would like for this to be an interactive discussion. And we encourage you to please use the chat box for any questions or comments that you'd love to share with the group. The other presenters and I will keep an eye on the chat box for questions, but if we miss any, Danielle Fuentes-Johnson will interrupt and read the questions to us so that we can make sure we are being responsive to your questions and any comments that you may have. So today's agenda is pretty straightforward. We just did a quick welcome. I will introduce the other speakers. We'll also share with you the principles that we have been using for this series around CCDBG and infants and toddlers. And then finally, we will get into the presentation. So today's webinar, as well as this series, is really due to our sponsors who are committed to this issue. As most of you know, in March of this year, Congress increased the FY 2018 CCDBG funding by approximately $2.4 billion. This is the largest increase in CCDBG history. Because of this historic opportunity, the BUILD Initiative, CLASS, the Center for Law and Social Policy, and 0 to 3 came together with funding from the Pritzker Children's Initiative to raise awareness of the ways that states might want to maximize the new federal dollars to support the least funded age group in the education continuum, infants and toddlers. According to the budget deal, CCDBG funding for FY 2019 should increase by $3.4 billion in order to meet the $5.8 billion increase outlined in the budget. However, keep in mind that Congress is not required to do so. So we just went through it. So very quickly, let me talk through our principles for investing through CCDBG for infants and toddlers. So we want to make sure that decision-making reflects the unique development of infants and toddlers. We want to ensure that this is a two-generation approach, so we want to make sure that we are including family members, the adult family members that impact children's lives. We want to think about our basics, but also move beyond that, and we want to take into account a vision, a strategy, and systems for ensuring quality care for babies and toddlers. A big piece here, number 5, is we want to think about and be intentional about equity for infants, toddlers, and their families, and we want to make sure that this isn't an afterthought, but that we're thinking about equity from the start. We want to make sure that we're considering and talking about all settings that serve families with infants and toddlers. We don't want to get stuck in thinking about only center-based. And we also want to ensure that quality is the floor for infants and toddlers. It is not the ceiling. In terms of our workforce, we want to make sure that we have empowered, competent, and compensated infant, toddler teachers and educators. And number 9, we want to be building quality infant and toddler child care supply, which goes back to number 8. And finally, we want to make sure that we are providing information and that we're ensuring engagement throughout building a system. So I'm going to jump back. Let me very quickly introduce today's speakers. We're really grateful to Bill and Sharon for all the time that they have spent both in preparing but also in spending time with us today. And I know that you all will have many questions and comments for them, so I know that Bill and Sharon are ready to engage in a discussion. So let me start with Bill, and I'll use his full name. So William Eddy is Executive Director of the Massachusetts Association of Early Education and Care. Bill formerly served as an elected city councilor in the city of Worcester, where he resides with his wife and 2 children. So thanks, Bill, for joining us today. And
thanks.
Sharon
Happy to be with
McDonald, thanks. Sharon McDonald is the Director of Member Services at the Massachusetts Association of Early Education and Care and the Director of Programs at the Guild of St. Agnes Child Care Agency in Worcester, Massachusetts. Sharon's 2 positions give her a unique perspective. At the state level, she advocates for effective policies and procedures around subsidized child care. And at the agency level, she implements these policies in the day-to-day life of an agency, providing child care to 1,600 subsidized children. Sharon started her career as an elementary school teacher in Philadelphia. She now lives with her school-age son in Worcester. Sharon, thanks for joining us as well.
My pleasure.
So now let me move us forward to beginning this presentation. For some of you who may have been at the BUILD conference this last year in San Diego, I just want to reiterate that we did begin this discussion there, and obviously we are excited to continue the conversation. I'll start by just taking us through some basics that we at the BUILD Initiative are really trying to think about, and then obviously we will turn it over to Bill and Sharon to really talk about the specifics. So we know that across the country, nearly half of children under the age of 3 live in low-income families. We know that the quality of the providers serving infants and toddlers in the system varies widely, and most significantly, we know that disadvantaged communities have fewer slots in licensed or unregulated centers. But we also know that infants and toddlers whose families participate in child care assistance are more likely overall to be in center-based care. We want to really stress here that the shortage of care is most acute for infants and toddlers, as is the compensation provided to the folks who care for these kids and families every day. A couple of pieces that we really encourage states and others to think about as they are considering payment and rate policies is really determining whether providers have the resources necessary to support high-quality infants and toddler care. We know that child care payment rates are consequential for serving infants and toddlers on multiple levels, including professional development and compensation of the workforce when you take account into ratios, implementing minimum health and safety standards, and other requirements. Over time, we've learned that rates are critical in determining whether providers have the resources necessary to support high-quality care and to ensure the overall positive development of children and their families in quality care settings. We know that funding services that match the hours that families need is critically important. Would now like to move into a couple of state examples that we've heard about over the last couple of months. Obviously in Vermont, they are thinking about targeting infant and toddler providers with a higher percentage of CACFP receipts, making sure that using CCDBG funds to increase infant and toddler reimbursement rates. In DC, which I think many of you have heard about, is they've really taken into account unexcused absences, so making sure that providers can still get paid for 5 days per month. And then obviously thinking about excused absences that may be approved for up to 15 days a month, and this would include childhood diseases or injuries, but really taking into account the fact that infants and toddlers need to see the doctor more often. So most of you are fully aware of the AAP schedule of well child checkups for infants and toddlers, which we know is at a minimum 11 visits over the time period that babies are growing. Just a few more quick pieces here. We know that Oregon reimburses for childcare between shifts for parents who work split shifts. If families are picking up their children from childcare in between their work schedules, we know how difficult that can be. Virginia allows sleep time to be included in a parent's schedule when a parent works non-traditional hours and must sleep for some of the hours while his or her child is awake and in care. And Pennsylvania reimburses for child care during sleep time, again, if a parent work shift ends between 12 a.m. and 9 a.m. We also know that a couple of states, which you can see at the bottom of this slide, Connecticut, Kansas, Florida, and so on, also allow for reimbursement for travel time without time limits. And then obviously, we want to make sure that we're also taking into account our parents who are also students. So we know that in Vermont and in Maine, they allow for study time, so reimbursing for up to 1 hour of study time per credit hour. And then obviously, a piece that affects families on a regular basis, copays. You can see there the list of states who are considering reducing the parent share of the copay when a higher quality provider is used. A couple of other pieces to really think about is using an alternative rate setting, making sure that the surveys reflect the cost of care and that the design that you take into account actually spreads costs so that you cannot charge families for higher costs. And then thinking about contracts and or partnerships, particularly when you're really trying to close the gap in child care deserts for infants and toddlers. So with that, I am going to turn it over to Bill and Sharon.
Oh, thank you very much, Danielle. Happy to be with you today. I represent the Massachusetts Association of Early Education and Care. We are the trade association for private community-based providers across the Commonwealth of Massachusetts. The commonality of our private mission-driven community-based programs is that they choose to provide service to children who are subsidized by the federal and state government. Those children range from 6 weeks to age 12, going through our infant, toddler, preschool, and after-school programming. They essentially comprise three groups of children. Children who are low income, whose parents are low income. They are above they have the 50th percentile of the state median income or above. They economically age out at 85% of the state median income. We also have children who transition off of federal assistance programs, welfare. And finally, the last and unfortunately growing group of children in the Commonwealth who receive our care are children who are in the custodial care of the Commonwealth of Massachusetts due to abuse or neglect. That population has almost doubled in the last 5 or 6 years. So it makes for a complex programming. So we are especially pleased to be part of this program because of the focus on infant and toddler. It's a subject near and dear to our heart in Massachusetts. As we have watched a trend in the last 5, 6 years out of Washington and other places about preschool programming, which we share the need and the importance of. We have tried to balance that with what we, with pride, focus on here as a complete system of care in Massachusetts. Whereas I mentioned earlier, children come into our programs at a very young age. We have worked hard to build infant and toddler programs, both in our center-based programs and in our family child care systems. which I won't go into great detail, but I know family child care systems are kind of a unique Massachusetts and a few other state initiative. So we have tried to balance the need for preschool initiatives, especially as the PEG program coming out of D.C., with the need to ensure that we keep in mind that these 1,000 entities that are private community-based programs that are taking subsidized children are, in fact, small businesses. And that if you take preschool as a sole priority, it has a tremendous impact on the rest of our programs. So as we've gone through legislative hearings out here, we were heartened last year when our Commissioner of Early Education testified that the department shared our belief that the focus must be on the system as opposed to just a portion of the system. So right now we have almost 55,000 children in care. We have about 19,000 on our state wait list. And of that, about a quarter of them are waiting for preschool, but 75% of our wait list are an infant or toddler or after-school programming. So we are, let's see, we also want to talk about how we get compensated? And then
Sure. So there's two ways, and I believe Massachusetts is somewhat unique in allowing for both vouchers and contracts. So we were asked to speak a little bit about how our contracting system works. The state of Massachusetts, every 7 to 9 years, when we're lucky, puts out an RFP for providers to get a contract for child care services for both income eligible and for supportive services, which would be the ones for the children that are in custodial care of the state. The contract, providers can bid on the contract, and the beauty of the contracts is you can ask for as many slots or as few slots as you'd like in infant, toddler, preschool, school age, as well as family child care, which basically, if awarded the contract, you are pretty much guaranteed the number of slots that you're going to have. So, for instance, I also work at the Guild of St. Agnes. We, 7 years ago, bid on a contract and received 314 slots, that a certain number for infant toddler, a certain number for preschool, a certain number for school age, a certain number for family child care. We know that even if the funding is frozen for some reason at the voucher level for income eligible children, we know that we're guaranteed to have child care reimbursement for those 314 children. What that allows us to do is to make plans. It allows us to go to the bank, ask for funding. For instance, we, in the past 5 years, have built 3 new centers. We were able to bring that to the bank because the bankers knew that we didn't have to worry about whether or not the funding would be there. It's guaranteed for the contract. We also, as we've made changes in our program, for instance, in some of our areas, the school districts have added their own after-school programming. We found that we didn't need to have as much after-school programming contracts as we did, but as Bill said, the number of infants grew. So we were able to negotiate with the state that as long as the guaranteed maximum obligation was fulfilled, as long as that total number was still there, we could convert some of our school-age slots into infant and toddler slots and vice versa. So it really gives us a lot of flexibility. It helps us. It's very hard to open a new classroom or open a new program if income-eligible vouchers are tentative. That means that, for 4 or 5 years, our new income-eligible vouchers were frozen because there was no funding attached to it. So, programs that only had vouchers weren't really willing to open a new program because you didn't know whether or not those vouchers would be there the following year. Whereas the contract, you're guaranteed for the minimum of 5 years, and then they can renegotiate it for 2 additional years, and in some cases, like in this current contract, we're now into year 9. Now, that does put some limits on the state, because that allows parents to go to a center or an agency that has contracted slots. But if you haven't won, if you didn't get that award, then those programs need another means for funding, which is the voucher system. Vouchers, as you know, they're statewide. They're offered statewide, depending on the wait list where those slots are open. The state determines how many vouchers in each region to deliver. And those vouchers, parents can go to the Resource and Referral Office, get a voucher, and bring it to any center or agency that accepts vouchers. And the centers can take one voucher, they can take 90% vouchers, they can have more flexibility with that. So the vouchers are very good for parents in that they give the parents a little more flexibility. However, as I said, our agency has contracts, but we also have a contract to have vouchers. So parents can still come to us even if we don't have any contracted slots available, or if they go from one center that has a voucher they could come to us. So there's definitely benefits on both sides. But I don't know how an agency the size of the Guild of St. Agnes would be able to survive if it was just voucher only, because the contracts really give us the stability that we need.
Sharon, we have a question regarding the 23% waiting for preschool slots and the other funding. Can you speak a little bit more to this?
Sure. Our wait list, people can go on the wait list through any means, and meaning that they can go online, they can call a central number, they can call a center. And we do not determine at that point whether or not the person is going to qualify. So parents say, basically in order to qualify, you need to be making 50% of the SMI, as Bill said, and also working full-time or going to school full-time. So we know that anyone who's on that wait list, we know basically their age, where they live, but don't necessarily know whether they qualify. We also know that there are thousands of other children that aren't even on the wait list. I get calls every day saying, how do I pay for child care? So I'm not sure exactly if the question is how they got there or what are we supposed to do with them. Basically, the state, our agency and other agencies try to use that number, try to get it as accurate as possible so that we can access some more funding through the state for new child care vouchers, as well as an increase in contracted slots. And we know that the majority of the slots are for infants and toddlers, the majority of the need based on the number of children. So the highest percentage of children that are looking for child care are infants and toddlers, mostly because that's where the least supply is because of the rate reimbursement. Mm-hmm. I'm not sure if that answers the question.
Thank you. I think so. It was about the funding, that other funding that was available.
That probably leads us into a little bit about our rate structure out here in Massachusetts, because there is I'm sure like many states, there is a competition for early education dollars that are either put into increasing access versus increasing the rate of reimbursement to address our workforce. About 5-6 years ago, as we came out of recession, there was a renewed campaign to work with our legislature about our rate of reimbursement for providers. There was a belief at that point, two factors hit. One, that the federal contribution to early education in Massachusetts, when you put together the federal money coming with our required match, was 92% of our overall funding. There was combining that with a study that came out in 2012 that showed that 37% of our workforce in early education was on some form of public assistance here in Massachusetts. we embarked on a campaign with our legislature to address our rates of reimbursement. And over the last 6 years, our legislature has stepped up, contributing almost $150 million of rate reserves. In the last 3 years alone, they've raised the rate of reimbursement 16% to try and address the early education workforce and program quality. So with that, it's made a very significant difference in how we pay our workforce. And as we now start to move to having a workforce that's paid a livable wage, we now are trying to address how rates are put together here in Massachusetts. Like many states, we use a market rate approach, and one of our goals in the coming years is to move Massachusetts away from that approach. We fundamentally believe that setting rates based on what people charge is a flawed concept. When you combine it then with the state's inability to do a market approach by community, which would cost the state tremendous money, they do it by regions. It's a very inexact science, and so there's two basic problems. There's an inequity that goes on by community, and second, it doesn't create a rate that matches the need for what does it cost to provide care. So we've begun an effort this past year, crafted legislation, working with allies in the legislature to develop a fair and adequate rate system that would require the Commonwealth to actually meet with providers to set what is an adequate cost rate that matches the cost of providing quality care. And we put a piece of legislation out that got quite a few co-sponsors, and actually got movement in one branch of our legislature to actually change state law in our existing statutes to say that along with looking at market rate, that the state should take into account what does it cost to provide quality care in setting its rate structure. That died in the Senate, our other branch, but we're encouraged by a first-year effort, and we're looking forward to spending the next 2 or 3 years along with trying to continue to raise our rates, but also to change how rates are developed in Massachusetts.
So, Bill, we have a question in the chat box. Does the union and the movement to unionize providers factor into this new rate-setting approach?
Well, Massachusetts, as you know, is a very blue state, and we have a proud union tradition. That said, in early education, it's really it's an outlier. It is a place that has historically been less than 1% unionized. So what happened about 3 or 4 years ago is on the family child care side, the Service Employees International Union took a different approach, and they essentially attempted to get around going to unionization one by one and sought to create a statewide union of providers who take subsidized children and to unionize against the state as a global entity in Massachusetts. The state teacher unions then proceeded to see if they could do the same on the center-based side, where of our 2,000 centers across the state, I believe there were less than 50 that were unionized. So what happened was the SEIU was successful in organizing the family child care side. Once they got that in, unfortunately for the SEIU, the U.S. Supreme Court then made a decision that basically ended forcing folks who were not in the union to pay basically a fee, an agency fee. That basically removed half the income the SEIU expected to be there and became a disincentive, and the state teachers union immediately disbanded their effort on the center-based side. So what we have in Massachusetts on the family side is there are about basically 5,000 family child care providers in the state. Of those, about half take subsidized children. of those, about half of those are unionized in the SEIU that negotiates directly with the Commonwealth. They represent a small fraction of who serves children in the Commonwealth. Those 2,500 that take subsidized children average a little bit over 4.5 children per center. It's a small percentage of those who actually provide care. The vast majority of children are in center-based programs, and they are non-unionized. Okay. There is a small amount of public preschool programs in Massachusetts. The city of Boston, notably, has free preschool for 4-year-olds. Just as a side note, Massachusetts funds through all our programs, through the federal block grant, each preschool child, the average that the Commonwealth pays is $10,300 per child. The city of Boston, using school money, pays about $16,000 on average per child for free preschool. But they are, of course, unionized with the public school teachers in Boston. But that really is the extent of our unionization in Massachusetts.
I appreciate that. We have a few more questions, and again, we really do want this to be as interactive as possible, so continue to put those questions in the chat box. Another question we have, two related to quality, and one is quality care defined in the legislation? And then what process are you using to determine the cost of quality care?
Well, in a perfect world, we would have a QRIS system that defined quality. And I know some states are way ahead of Massachusetts on QRIS. We unfortunately are in year 9 of developing a QRIS system. So the cost of quality, of course, is what is quality is subjective. For years we hung our hat on NAEYC accreditation. Massachusetts state government has begun to de-emphasize, the benefits of NAEYC accreditation. And without the development of a QRIS system that would define quality, we are left to have our own interpretation of what exactly quality is. Sharon, what are there?
That being said, in order to have a contract, you still have to have NAEYC accreditation. So the majority of the providers of care, subsidized care, are nationally accredited. We have a QRIS system that is being redeveloped, has a computer system that is also being redeveloped. So we are acting in a QRIS system, and at this point that's being used to incentivize programs. For instance, in the preschool program, you can get a grant for classrooms that gets rebid every 2 years, provided that you're at a certain level of QRIS. But again, the QRIS system is being redeveloped as we speak, so it's a measure, but it's not the best measure that we have at this point.
And
so there's, as well as family child care, they used it originally, the QRIS. There was a little bit of a rate increase for those providers that were higher up in the QRIS system, but until the QRIS system is really finalized, they're hesitant to use much rate changes based on your quality standard.
So, yes, in the legislation, we are defining vaguely what quality is: curriculum, staffing ratios, the providing of extra services, food, transportation, et cetera. And yes, in the legislation, we are detailing how the state should interact with providers in creating a rate that meets the cost of quality.
Okay. And then we also have a question related to, does the rate include ECE programs to hire and work with child care health consultants on a yearly basis for caring for our children national standards?
Yeah, that's part of part of the QRIS. One of the requirements is that there be a healthcare consultant to work with programs, to visit annually, to review the healthcare policies, to do visits as needed, and to be on call as needed. However, our supportive children, our children that are involved with the Department of Children and Families, we are also, we work with a lot of behavioral health specialists and a lot of other services. Early intervention comes right in. We work with the public schools who provide preschool services to those with children with disabilities. So there's a lot of case coordination that happens for our children, for all of our children, but particularly with our children that have open cases with DCF. And so that kind of goes above and beyond the healthcare consultant role.
Danielle, our contracts that are part of the children that are in the system through abuse and neglect, there is an add-on component to so the rate is basically broken into two parts. One is the basic contract rate that is for all our slots that are contracted. The second is there is an add-on rate for those 7,300 children that are in the system for those reasons. And the add-on rate is meant to be comprehensive, to include transportation, to include case management services and the behavioral health services that Sharon just talked about.
And each of those children has a social worker, and our programs that work with the DCF children really work hand in hand with those social workers, reporting what they're seeing with the children, with the parents, with the foster parents, with all sorts of things. Many, many times, besides being a mandated reporter of abuse and neglect, it's also just given social workers heads up that they moved and didn't tell their social worker, or kid is coming in especially hungry or especially dirty, and filing on them. But it's the steps before it gets tragic that we are really working with.
So we have a question, another question circling back to that when it talks about setting rates based on cost of quality. Just circling back, do you have a tool that you're using or a process that you're using in particular to set that cost of quality?
Well, no, not really. There's no tool. In Massachusetts is one of the $15 an hour states, meaning we just passed a law in Massachusetts that says in the next 2 years that minimum wage must be $15 an hour plus it's guaranteed paid family leave, which, as you know, will complicate for others on this call that are in similar states. It complicates our salary structures. If our lowest paid employees are getting paid slightly above minimum and the minimum wage has gone up, we now have to figure out how to make sure our teaching staff is significantly above. And so we have been on a quest on our rate campaigns to move our workforce up out of the poverty levels and to get them over the magical $15 an hour, and have just got our average teachers to the $15 figure this year after the last three big increases from the state. As we now go up in the next 2 years, that will drive a lot of our campaign to make sure our staff stays well above it. So that has driven, we have sold to the legislature that a key component of quality is consistent early educators. We have argued that on the K-12 side, the Commonwealth of Massachusetts would never put up in any community with having 3 second-grade teachers in a classroom in a calendar school year. Parents would be in an uproar, and they would just be justified in being in that uproar. Yet, it's common for us to lose staff, in the same preschool classroom 3 times in 4 months, given that how the salary structures are. So we have made that campaign over the last 3-4 years successfully to legislators and said that our first steps of ensuring quality are consistent caregivers, and also campaigning on what should be credentials of our workforce. So that's been a key thing for us. We've also campaigned hard on our licensing standards here in Massachusetts, which are some of the stringent and the most stringent in the country. And I guess Sharon said we continue to wait and build off the QRIS system that's in progress.
Fantastic. We have another question. Part of it, I think, is directed at Sharon, and then also for you as well, Bill. Can you talk a little bit about whether or not you are a nonprofit consortium or are your programs for profit, and just review again for the audience request for the agencies you're associated with?
So again, we are the Massachusetts Association of Early Education and Care. We are a traditional trade association that represents providers across the Commonwealth of Massachusetts to provide early education services. We took the step, originally we were nonprofit agencies that are nonprofit agencies. Well over a decade ago, we changed that policy. And essentially the commonality of our members are we don't really care about their tax status, and we have a great number of for-profits that are part of our association, including a number of members of our board. The tax status to us is irrelevant. The commonality of our folks is that they choose as a mission-driven program to take subsidized children. That, you know, for all our efforts on rates and for the successes we've had, there really are, like in many states, two systems of care in Massachusetts. One that for children that are in our subsidized programs, that take subsidized children, those rates are remarkably lower than the private fee-paying programs that don't take children who are subsidized. So it is, for us, it really doesn't matter about whether you're profit or nonprofit. It really comes down to mission. And so that is who our members are. And we have many for-profit and nonprofit members.
And it's interesting because there are many, many for-profits that are not part of us because they clearly don't have a mission. But when you look at the for-profit members of MATCA, many people wouldn't know the difference, you know, looking at them from how they approach the work before us.
Thank you for sharing that with us. We have a comment in the chat box that the Center for American Progress is working on a cost of quality tool that will be widely available later this year, that will be useful to help states and localities to do cost modeling using different variables. So thank you for that feedback, and continue to...
Who is the Center for American Progress? I don't know them. Do you know who the Center for American Progress is?
Cap, we will put the resource in.
The Center for American Progress is a nonprofit organization based in Washington, D.C. They have a early childhood division there, and they do a lot of work around advocacy, but also around tools for the community at large, but they are a national organization.
Terrific. Thank you.
Oh, and Gina just put up their link. Thanks.
Thanks, Gina. Again, please continue. We really appreciate this dialogue and discussion, and continue to put your questions in the chat box or comments or other resources that you may want to share.
So Bill and Sharon, this is Yvette. I have one quick question. I actually had several, but folks have been putting those through as well. But one of the things I actually have two questions around providers. Bill mentioned in one of the first slides that providers have really become part of the system. And I'm just wondering, how did you all convince programs and providers to actually become part of the system that you all are working on? So trying to go back really quick to the so in the first slide you mentioned that there are nearly 1,000 private community-based early education programs that have made a conscious business decision to be part of this. And I'm wondering how that happened. And then my second question goes back to the third slide where it states that providers can actually advocate for a daily rate, and I'm wondering if there's a current criteria that is used to approve a rate that the provider is advocating for.
Oh, I don't know what that was. Sorry, we had a weird sound over here. So to go back to the first question, the 1,000 private community-based early education programs, there are about 2,200 center-based programs in Massachusetts. So a little bit less than half choose to service children that are part of this system of care. They do so based on a number of factors, certainly economic, and getting rich is certainly not one of those factors, because, as I mentioned, the state rate, despite its progress, is far below what the private fee-paying market pays. For instance, in the city of Boston, if you are a private provider whose market is to parents who are above the state median, above the 85th percentile of the state median, you are charging somewhere around $85 to $100 a day for infant care. If you take the state rate for children who qualify for state subsidies, you are getting paid somewhere around $65 a day with the state rate. That's up dramatically from about $50 2 years ago. So there is a difference between that. So they make a decision not based on economics, but they make a decision based on what the mission of their agency is. And often with their boards of directors, choose to be a program that provides service to the children that are subsidized by the Commonwealth and the federal government. We have been successful in bringing the majority of those into our membership using the argument that there is strength in numbers in early education, that it's a field that as we compete for limited state resources up in the legislature and with the governor, that we are never going to outgun the insurance industry or the beer lobby with their numerous lobbyists that dwarf how many we have. But we have had great success engaging this 1,000 private community-based programs to work with their legislators and make great strides up on the Hill up here. The second question, what was the second question on the? Oh, providers advocate for daily rate. Yes, right now our daily rate is set by the Commonwealth of Massachusetts Department of Early Education and Care. What we have done is to bypass them and go to the legislature and ask them to provide rate increases each year to direct the State Department of Early Education and Care to adjust the rates of reimbursement each year to move them up. And as I've stated earlier, over the last 3 years, they've done so to the tune of 16% over the last 3 years, which has made a big difference. And with legislative earmarking language in the line items to direct that money to go toward early education workforce salaries and for program quality.
So, years and years ago, we used to be able to, agency by agency, set a rate based on costs. They got rid of that method. But again, and we're also governed by a board of early education and care that's the governor appoints. So the board actually has to approve the rate, but that's based on funding that has been allocated by the House and Senate. And we've really worked really hard. We have a wonderful Speaker of the House who is very committed. We're one of his 2 top priorities, and without that, unless you have a friend in the legislature, you're really stuck with whatever money is there. So we've really, really pushed hard over the past 10 years, but it's really the last 3 years it's starting to show some progress.
Great, thank you.
Thanks for all those questions. We do have a little bit more time if there are any other questions or related to the slides that were shown at the beginning of the presentation as well. So continue to put those in the chat box. We'll turn it back over to Bill and Sharon.
I think we're there. I mean, look, we're very appreciative that you're having this call, and especially talking about infants and toddlers.
One of the things I think, one of the ways the infant and toddler question is really challenging from an agency perspective because, it does cost more to provide infant and toddler care, and because of the ratios. And so one of the ways that I know at the Guild we've managed to do it is because we also have we're a complete system in that we also have after-school care, preschool care, and our family child care. So even though we may be losing some money for infants and toddlers, we make up for it in some of the extra money that we receive from school age because the ratios are higher. But one of the things, despite all of that, one of the things that we've learned, unlike what is reported in this, is that more and more programs in Massachusetts are pulling the infant toddler care out of centers and putting them in family child care homes. The rate of reimbursement is a little higher comparatively for family child care, because the rate has been stagnant for so long, except in the city of Boston, as Bill just pointed out, and the surrounding towns of Boston, even with being able to offset the cost by some other programming, we haven't been able to sustain the infant and toddler care model in the center-based programs. So, like at the Guild, we have 10 child care centers. We work with 125 family child care providers, and of all of the infants that we serve, most of them are in the infant toddler program. So it's really about making it work. Working with other agencies to see how it is that they're doing it, and trying to be innovative with given the funds that we have.
Fantastic. Thank you so much. We'll invite any last questions or comments for Bill and Sharon.
So this is Yvette. Before we move on to the final slide, Sharon, I really appreciate you sharing that lesson learned. And I'm wondering, Bill, do you have any other lessons learned that you would put out to the group as folks are thinking about? And I know folks will have more questions once we get off the phone for Bill and Sharon, but in the meantime, I'm wondering, Bill and Sharon also, if there are any other lessons learned that you could share with the group.
Well, the danger of the only downside I could give you is in terms of having a contract system, which I know is something different in Massachusetts. I think California uses contracting. There's not an awful lot of states that use contracting, we understand, but I would tell you that it has a myriad of benefits that Sharon outlined earlier. The only downside to a contract is we have found in Massachusetts is that it's a lot of work for the state government to bid it, and there's a tendency to let it go too long. And so, for instance, as Sharon talked about, we are in. Did you talk about 5-year bid with 2 rollover years? We are now in year 9 of a 7-year bid, and the environment in Massachusetts has changed dramatically in 9 years geographically. Where we've had children, less children in the cities, more in the burbs, and it no longer matches really well the contracts that were bid out. And so what we end up having is danger of letting a contract go on too long is we have empty contracts in some parts of the state and waiting lists for contract slots in other parts of the state. So if providers choose to advocate for a contracted system in other states, you want to ensure that it has flexibility in the contract, that contracts can be moved by regions of your state as need arises or as need no longer has, as there no longer is a need in certain regions. It's one of the things that we didn't do well enough, that when we developed the contracting system, we didn't put enough flexibility in the contract, and we paid for it a little bit over time.
Bill, we had one final question right now, and that is someone wanting to know about license-exempt providers, and how do they factor into the rate setting?
We indeed, like many states, have license-exempt programs. They are predominantly public schools, although we do have a small percentage of religious-based exemptions. Essentially, they don't factor into this system. In the subsidized world, they are almost all in licensed programs and all get the state rate. The license-exempt programs in public schools, first of all, very few communities are even doing early education programs, and the ones that are both basically either using public school money, which is not the same, it doesn't come from the block grant, or they have cut deals with private providers to have providers provide services for them. But essentially the license-exempt programs are not really part of the system.
And
yeah,
what about families?
There are school after-school programming that does get vouchers, and they are license-exempt, but the rate is the rate regardless of whether you have a license or not.
Okay, and so that extends to family, friend, and neighbor care as well?
We only have a very, very small number of that in Massachusetts. It's really, we had some issues in family, friend, neighbor care, and Massachusetts has really tried to get away from that. And so it's a very, very small percentage here in the state.
And their rate is different than the center-based rate or the family child care rate.
Thank you. Okay.
Great. Well, this is Yvette again. Thank you all for the questions and the comments. Before we finish up with this webinar, I just want to take everyone back to the recommendations. The BUILD initiative, along with partners, are really encouraging states to think about as they consider payment and rate policy changes. Obviously, the first one is around improving payment rates for infants and toddlers that are linked to the cost of quality care and taking into account all of the pieces that we shared earlier, ratios, group size, compensation. We know that it's a little more expensive to serve infants and toddlers. Consider alternatives to voucher payments, such as contracts, which we heard a lot from Bill and Sharon today. And then number 3, provide ongoing payments to providers and caregivers for all days. We know that babies and toddlers have a lot of pieces going on for them, particularly when we consider child well visits, as well as just different schedules for families. And then obviously the fourth one is providing for sleep time, travel time, and study time for parents who are working non-traditional hours, and for those parents who are also going to school or taking classes of any sort. So just the 4 major recommendations. I also just want to share with folks that the next couple of slides are several resources from a variety of groups, including Child Care Aware of America, the state of Colorado, some resources from the different partners, including the BUILD Initiative, ACF, so the Office of Child Care at ACF, including some resources around strengthening the workforce, not just for under 5, but taking into account school age. And then I just want to remind everyone that the PowerPoint, the recording, and the resources will be available at the Build Initiative's website. It's included in the chat box, the full link, for those of you who want to click on it or go ahead and copy it. And just finally, I'd love to thank Danielle for all of her logistics support as well as facilitation. And obviously, Bill and Sharon, thank you both so much. I know that folks will probably be contacting you offline or individually. And thanks to all of you for joining us today. We really appreciate the work that you do every day for kids and families in your communities and across this country. So thank you all. Danielle, I don't know if there are any last final logistic notes that folks need to be aware of.
Thank you so much, Yvette. And Bill and Sharon, again, thank you. We would just like to extend the invitation that our next webinar in this series will be on October 17th, and it will be Crafting Systems That Work for Infants and Toddlers and Their Families, Exploring QRIS. So again, on the landing pad, you'll have a link to register for that as well. And with that, we'll thank Yvette, Bill, and Sharon again, and have a wonderful afternoon.
Bye-bye.
Thank you.